Good afternoon, everyone. iTech India welcomes all the participants for today's National Distance Learning Seminar. Today's topic is COVID-19, Vaccines Information for Transgender Population, and the speakers are Dr. Amit Harshana and Dr. Aqsa Shaikh. Dr. Amit Harshana is the Senior Medical Advisor with iTech India. He is MD in Community Medicine and a Fellow of Royal Society of Public Health. He has extensive experience working with national and international organizations in the capacity of medical lead and public health researcher in programs like HIV, TB, malnutrition, immunization, etc. He has been involved in various operational researches in India and internationally. Dr. Aqsa Shaikh is a MD in Community Medicine and a Fellow of Advanced Course in Medical Education. She is Associate Professor of Community Medicine at HIMSR Zamai Hamdard, Delhi. She is a proud transgender woman and works on queer rights of persons with disability and mental health. She is the founder, director of Mizan Commercial Enterprises and Human Solidarity Foundation. Her keen interest areas include medical ethics, medical humanities, and medical education technology. We welcome you both to the session. We also welcome Dr. Chinmay Das ma'am, the Deputy Director at NACO, CST Division. Dr. Chinmay ma'am, you are requested to kindly address the session. Praveen ji.
Thank you.
Thank you, ma'am.
Thank you so much. Is Hindi comfortable or English?
English, please, ma'am.
Okay, thank you. So, very good afternoon to all of you. This is a very unique platform that we have today, and the topic itself is another unique topic. I'm not sure if we have ever had a topic wherein we have discussed about COVID per se, or COVID vaccination for transgender population. So we welcome you all for this meeting, though I'm not directly looking after the prevention component of NACO, but definitely as a part of NACO and as a part of the program, we consider the transgender population, of course, as our group. So, you belong to us and we belong to you. So our equation is like that, because the National AIDS Control Program is the only program in the country which tries to address the needs, the equalities, the responsibilities, the issues which are related to the transgender population. So with this, I welcome you all. So we do have good speakers today, Dr. Amit and Dr. Aqsa, who are going to take you through not only discussing about the COVID vaccines, but also addressing any of the issues, psychosocial issues or other issues that you face in today's discussion. So I would like to reiterate, by now all of you know that since January we had the vaccines rolled out in India, and 16 January we started this vaccination campaign and rollout, and we tried to prioritize the population. We started with all people who are above 60 and those who are frontline workers. So our focus has been on frontline workers and healthcare workers to be prioritized. Then in March, we had a guideline issued by the ministry wherein we discussed about prioritizing any individual who has any comorbidity listed in the 20-point lister that was circulated. So, there it was not gender specific, or it was not excluding any gender, but we ensured that anyone who had this comorbidity should be put in the priority list. Then 1st April onwards, we prioritized that 45 years and above should be given vaccine, then 1st May onwards, above 18. So, after this, we have had various changes, modifications in the guidelines, be it for vaccine schedule, the intervals, the place where they are available. So all these have been prioritized based on countries' resources. And definitely we have understood what is the need of the population, and accordingly things have been, the guidelines have been issued. So having said that, we would like to reiterate that the mental health issues, psychosocial issues related with our population, I mean, be it of any gender or age or community. So irrespective of that, all those have to be addressed, which various guidelines you will find in the ministry's website. There are many websites which talk about stress, I mean, de-stressing, how to manage stress. So I'm sure all of you must have gone through that. Because when we talk about vaccines, we are thinking about how do we develop antibodies, how do we develop immunity, how do we develop resistance, so that if we ever get infection, how to fight it, and of course, how to prevent having the infection. So, so these guys, please see the ministry's website whenever you have time. Of course, social media nowadays has a lot of material wherein the mental health issues and other things are being addressed, and people are repeatedly told that ensure that you are happy so that you have a healthy body. So that is the foremost thing wherein when we talk about, developing immunity. So that should never be ignored. So of course, ministry has a lot of IEC material. Also, NACO is coming up with various IEC campaigns and IEC material, wherein we want to ensure that, number one, in the communities whom we cater to, be it any key population, including transgenders, be it any person living with HIV, all the communities. So how to ensure that awareness is spread adequately, and how to ensure that we are trying to vaccinate all of them. So we are coming up with various awareness campaigns and guidelines, of course. So recently, on 2nd of June, we have also sent a guideline to all the states, wherein we have ensured that all those who are working or supporting the program implementation in any capacity should be prioritized. So this has gone to the states. So prioritized for vaccination. So therefore, do make sure that you are linked to your concerned SACs and ensure that you all get vaccinated, because that is the first step in ensuring that even if you get an infection, so it will be mild and you can recover faster. So, the other things related to vaccine, like why, whom, when, how, all that Dr. Amit, I'm sure, is going to cover in his presentation. And if you have any other issues wherein you want NACO's intervention, do reach out to us. So we have our program division headed by Dr. Shobini Rajan, who's the DDG for TI, and we have Dr. Bhavani, the DD for TI. So they have been closely working with you always. So make sure that whatever queries and issues you have, do address to them through email, or maybe I can also take the messages that you give today. So not taking much of your time. So I hand over to Divya or Shweta. Okay.
Yeah.
So thank you very much.
Yeah. Thank you, ma'am, for your kind guidance. Just 2-3 things before we start the session. The language will be English. This will be a 1-hour session since we have received many questions. And do type your questions in the chat box. They'll be addressed at the end of the session. I now request Dr. Amit to kindly start the presentation.
Hi, good afternoon all. Thank you, Dr. Chinmay, for your time and for the guidance. Thank you, Shweta, for kind introduction. So in today's topic, we have had the NDLS sessions on COVID vaccines before. So the intent of this topic today is that we'll be going through some of the basics on how a particular virus infection is affecting the body, and what does body do in response to that particular infection, and also we'll look at what are the different types of vaccines that are available at the moment globally, and specifically we'll talk about what is that in India. Then we'll also look at because there are several terms which are being used loosely in the social media platform when we talk about the efficacy of vaccine, etc. So I think we'll see what does efficacy mean, and how does it affect in terms of when we look at our body or our communities. And we'll also look at specifically what are the different needs of vaccines in terms of different populations. And then we'll in the end we'll talk about the strategies to fast track the vaccination process. So overall, this topic, because the audience is such that will not go into the too much of the medical details, but we'll try to cover the topic well. And we have also already received a lot of questions. So the overall presentation is around those questions, and in the end also we'll open the session for Q and A's, and then we'll try to take the questions. And then it's good that Dr. Chinmay is also around, so in case if in the end if we find that there are some things that need to be done or to be followed, and then from there we'll take it up and to NECO, and then follow it up from there. So starting from the very basic and first thing is, I'm sure all of us and all of you must have seen the virus picture for now so many times. So because what we need to know is, from here we'll talk about how does the virus look and what it does to the body. So in a very simpler terms, on the left side what you're seeing is that's how a virus looks like. So this is a virus, and this is COVID virus. So this has got two different layers, and for us to remember or to know is, there is something on the top of the virus which is called as a spike protein. So this spike protein is important for us, for those who are there in the medical field, because this is the protein which is ultimately causing the disease, or is responsible for causing the disease. And also this is the protein from which certain parts of this protein are being used to develop the vaccines. So that's why it is important to just to know the very basic thing. So on the right side on your on the slide, the zoomed out picture of the same spike protein. So this is the protein which is responsible for whatever is happening. So this is something which is called as also as antigen. So before we go into the typical what happens when the virus enters into the body, just for us to know, because again I'm repeating, because this is a mix of audience, so a lot of people are non-medical, so we'll try to keep it simple in terms of understandings. So there is something called antigen, there is something called antibody. Now we all know what is antibody is, but just to reiterate and just to explain, antigen is something, a substance which enters into the body by any means, and then can cause disease or can generate the immune response. So that is what that's a particular substance is called antigen. And then antigen, when it enters into the body, it starts the immune response. And by immune response, what do we mean by those things? We'll see in subsequent slides. So as I talked about the antigen and an antibody, there is something which is when we take birth. By birth, we have certain resistance to certain infections. Let's say, for example, our body has got the resistance to fight against certain infections, and that comes from, there is something called which is inborn or innate immunity. There are different cells or things responsible for that. Need not to go into the name of those things, but that just to remember that we have the immunity by birth, and that's called innate immunity. And then there is something called adaptive immunity. Adaptive immunity is the immunity which a person develops during the course of the life. So when you're exposed to a particular antigen, or let's say for infection, then your body starts fighting against that infection, and that's when you develop certain antibodies and certain responses to fight against that particular infection. That's called adaptive or acquired immunity. And then how does that work? We'll see now. So let's say, let's talk about that there is an antigen, or there is something which is causing a disease. So here, in this example, we have the COVID virus. So when that virus enters into the body, then there are certain cells which picks that antigen, picks this particular virus, and then takes this virus to something called as immune cells. So these immune cells then ultimately starts working, and then there are mechanisms by which there is one mechanism on the right side which you're seeing is that the body starts developing antibodies. So you must have heard about antibodies a lot of times. So this is how the antibodies are there, and then what would antibodies do? Antibodies will try to neutralize the virus and also will help to reduce the virus replication. So ultimately reducing the count of the number of viruses. And also at the same time, there is also something called cell-mediated immunity. That particular immunity is that will try to kill the infected cell. So once the virus has entered into the body, into the cell, it will try to replicate, and it will also try to kill the infected cells. So these are the two different types of immunities by which one tries to reduce the replication of the virus, and the second one will try to kill the infected cells. So that's protecting the body. This is the immune response which we have. Now, in the similar aspects of what we just discussed, so just remembering of that we have some inborn resistance, and then there are some mechanisms, and then we develop immunity when we are exposed to a particular antigen or infection. Now on this slide, on the down below on the left side, if you see, what you are actually seeing here is, let's say this is the point where the virus enters into the body, and there are few days after which the person starts showing symptoms. So there is something called incubation period. So need not remembering the names, but just for our basic understanding again, when a person is exposed and then person develops the infection or the symptoms. So suppose this is where the person is developing symptoms. What has happened is, remember we talked about that there is something called which is our inborn resistance or the innate immunity. So this plays a role, and this is where the innate immunity or the inborn resistance is going to be there. And it is for all the infections, not just for a particular COVID infection. This is going to be an in general response for all the typical antigens or the foreign substances that enter into the body. Now, the second thing which is happening is, you see this is this thing going up and coming down. This is a viral infection. So this is a viral load. The viral body is going up and coming down. And then in the background, what is happening is, so after the innate immunity, our immune system starts working. So that is our cellular or the antibodies mediated response. So what will that do is, all this antibody response now what we have will try to reduce, remember we talked about that it'll try to reduce the replication of the virus and also try to protect the cells by killing the infected cells. So that's why then ultimately the viral load or this particular thing starts coming down, because you have the immune response. And then if immune system is not good, then we all know what happens, etc. So this is a typical response for a particular viral infection. Now let's see, in the same manner what we just discussed right now, that we talked about what is antigen, right? So antigen is something which is giving you so this particular antigen is a substance, gets inside the body, and then you develop the immune response in a very simpler terms, if you want to understand that. Now, what is a vaccine? How vaccine works? This is why, so we gave the background of this basic immune response just for us to understand that how vaccines work. So when we talk about the vaccines also are a delivering agent. So vaccines are actually giving you immunogen, or immunogen is the antigen which we just talked about, that would be able to elicit the immune response. So the vaccines, they will activate the immune response, and you will have either the antibody based response or the cell based immunity response in order to curb the transmission, curb the severity of the disease, you develop the immunity. So all those things are because of once you get the vaccine and then you develop the immune response. So these are the two different type of responses one can have once you're being given the vaccine. Now, look at this particular slide, and this is very important for us to understand now. So there are two scenarios. Just keep in mind that there are two things that can happen to a person. So for example, if I am infected before, so I got the COVID virus, and then also I would have antibodies because I was infected, the antigen entered into my body, and then the acquired immune response that we talked about. So I'll have certain antibodies. At the same time, suppose let's think about that the person who is immunized. So immunization is when you get the vaccine and then you develop the immune response. So in both the scenarios, the immunized person would have a beautiful antibody response. In this graph, what you're seeing on the top is this is immune response. This is the antibody response which you typically get when a person who's already immunized then exposed to the infection again. So this case, the virus you see, this is the virus amount. It is not going too high, and it is not going to have a lot of issues in terms of affecting the body, giving you the disease, etc. So if you have a protective shield, for example, by the immunity or the antibodies and the cytotoxic or the cell-based immunity response, then you are protected. And this is what the basic thing is when you say how the immunity works in order to prevent yourself from getting very sick or even protecting you from getting the infection. We'll see what is the difference in these two in subsequent slides as well. Now, what we just now talked about is so how the basic immune response and how the vaccines are giving you the protection. This is important for us to have a further discussion so that everybody is on the same page. Now, globally, right now, there are different types of vaccines we are having. There are different names. We'll go into the basic details of how each and every vaccine works. So let's see the viral vector vaccine. Viral vector vaccine is a vaccine which is being used in India. And the example for that vaccine is Covishield. We also have different viral vector vaccines. One is Johnson and Johnson, which is being used in USA, and now we are also having Sputnik. So all these are different viral vector vaccines. What viral vector vaccine is, it has a non-coronavirus vector. So this is suppose this is a vehicle or a carrier, and in case of Covishield, we are using chimpanzee adenovirus, and in case of Sputnik and J&J, we are using human adenovirus. So this normal flu virus, let's say for example, doesn't cause a disease for us. It doesn't cause much of a problem, but it just provides us a vehicle so that and then it has a gene inside which is encoding for the SARS-CoV-2 antigen. So the antigen which is responsible for everything. But then this antigen, which when it enters into the body, please remember this is only eliciting the immune response. So that's the difference when we introduce something into the body in terms of vaccines. It will not lead to the infection. It is only going to give you the immune response. This is how it is being made or created. So viral vector vaccine is a vector is being used where you have the gene which is responsible for COVID-2 antigen, and then it gets inside the body, and then you develop the immune response. Once you have the sufficient immune response, you're protected against the disease. Now, the other type of vaccine is called as inactivated virus vaccine. In this, what we do is the virus is being neutralized or being exposed to certain chemicals so that the whole virus is now inactivated. Now, this inactivated virus, when it enters into the body, then will again develop the immune response. So viral vector vaccines and the inactivated virus vaccines will have a bit of difference in the immune response, but then that is too much of knowledge in immunology that you would need in order to understand how to define the doses, etc. That happens at the vaccine developmental stage, but not for us to discuss in these sessions. But what we have is the inactivated virus vaccine. The example is Covaxin. So Covaxin is our inactivated virus vaccine, and Covishield is viral vector vaccine. But again, I'm repeating the same thing. The mechanism of action is same, almost same, and then it provides you the immunity. That is what the basic outcome is for any different type of vaccines. Now, the other type of vaccine which you all must have heard is RNA vaccine. The example is Pfizer and Moderna. So what that does is, so in RNA vaccine, you have the mRNA, or you can say this particular genetic material which is responsible for for SARS or this genetic material encoding or having the SARS-CoV-2 antigen. When it has the antigen, what it does is it enters into the cell. Again, through the mechanism of action, there are several things inside the cells happens, and then ultimately it goes to the immune cells, and then you develop the immune response. So the example for mRNA vaccine, as I said before, is Pfizer and Moderna vaccines. Now there is a fourth type of vaccine, which is viral subunit vaccine. In this type of vaccine, remember we talked about the S protein, which is a little spooky kind of a thing on top of the virus. So we only take that part of the virus, and then that is used as an antigen, and then we develop the immune response. So because the subunit is being taken, so we call it as viral subunit vaccine. The example of that vaccine right now is Novavax, and hopefully certain trials are going on. We'll see when that comes in market. Now, what we talked about is different type of vaccines and the different type of actions. We need not go into the details, but what we need to understand is mechanism might be different, but it is all ultimately leading to immune response. That is what is required for our body to fight against the disease. Now, for a purpose, I want all of you to listen to the different phases of vaccine development, because there are several questions and answers are going to be around these things, and it's important to know the very basics of how vaccines are being developed. So, vaccines usually, in a typical manner, it takes a number of years. It takes certain times. It takes almost a decade or even more than that. To develop a particular vaccine. Why? Because so the way we start is we usually start with the laboratory studies, or we call it as animal studies sometimes. So what we do is we have the antigen. We see whether the antibodies are developing in a particular case, and then we see whether once the particular subject is again exposed to the infection, whether it is protective or not. So once that is understood, that there is some protection, then we move on to the different phases. In different phases, what we do is we try to look at what is the safety profile of that particular vaccine, what is the efficacy of that vaccine. What does that mean is we look at the side effects. Then we also look at what is the dose required, what are the different gaps required for 2 doses, whether 1 dose is enough, 2 doses are enough, or we need to give boosters, etc. So these are the different phases. And also in phase 2 and 3, what we also try to do is, because there are 2 groups in these vaccines, where one group is being given vaccine and the other group is not given vaccine. And then we see what happens in terms of protection, and that's how you calculate the efficacy and the effectiveness. And then also what we try to do in these phase 2 and 3 trials, that we categorize the patients in terms of we try to match the demography, and also we try to match with the comorbidities. So we look at the different ages, we look at different sex, and we look at the whether it works in diabetics or in hypertensives or in PLHIV. So all that is being incorporated in these different trials. And then we see whether we are having the similar effect or the more side effects, or the efficacy is good or not. So all those are questions which are being answered in these trials. And that's how we understand whether one particular vaccine is good enough for example, people living with HIV, or it's good enough for those who are having diabetes, for example. So these trials are giving us the results, and then to answer to so many questions of what we get is like the Covishield initially had a gap of around 4 to 8 weeks, and then we increased the gap to more than 3 months. Why? Is it a political decision? Is it because of shortage of vaccines, etc.? So that's not the answer. That's not the real picture. So what happens is, So if you remember last year, the trials were ongoing, and usually, typically, if we do these kind of trials, the sample size is huge. So we also had a huge sample size for Covishield, and it was a multi-center trial, meaning that it was going on in different settings or different countries. So when that was happening, the data which we had at that time was showing or telling us that if you keep this gap, it is going to give you this much of immune response. But then subsequently, after the rolling out of the vaccine, we saw that if in a particular group, when we are increasing the gap between the two doses, it was giving much higher immune response. And that's how the decision came that for Covishield vaccine, the gap of 12 to 16 weeks or 3 months, minimum 3 months between two doses is good. And that is the reason, not the shortage of vaccine. So it's science which is teaching us that how do we proceed. And as we all know that COVID, every day things are, it's a new disease, it's a new platform, new things are happening. So that's why certain things keep changing. And also phase 4. So all the questions regarding the long-term side effects, etc. So phase 4 is still going on. So what that means is phase 4 is a long-term side effects monitoring kind of phase where we look for what are the long-term side effects. And also it's important that if there is something that probably we'll know, and it also depends on the monitoring. So that's why we have a huge system in the country which is called as AFI system, and then we keep looking at the adverse events monitoring. We look at the causality, we try to see whether it is actually because of the vaccine or not, or is it coincidental, etc. So all those different things are part of these long-term side effects monitoring, and that's a continuous exercise which is going on, and it is being managed in a very robust manner in all the phases. So whether the vaccine, so in these scenarios, in the emergency scenarios, because the vaccines were developed in a fast track manner, because of the public health emergency situation, we had to save lives. So that's why these certain trials, phase 1, 2, 3, certain trials were running parallelly. That was only the reason was that we had to save lives. So in tough situations, certain times, this is how things work. But then the good thing is we have vaccines which are protecting us and giving us immunity, and would definitely save lives. That's the reason I spent a lot of time on this slide, because it's important that the trust is there, and that's how we can spread the positive message. All of you, if you go to the Gavi Vaccine Alliance site, if you look for the different phases of vaccines, you can click, and then you can see. If you're interested, you can simply go to the slide and see that what are the different vaccines available in globally, and in on or in what phase the vaccines are. Just for the information, for the infographic, we have kept it here. Now, as of now, from the WHO side, what we have seen is around 287 candidate vaccines, and then in clinical phase around 102 vaccines are there, and preclinical phase 105. So a lot of science and support that we have received, and hopefully this is the time where everybody had to come together, and that's why it is important to develop these vaccines, provide the vaccines in equitable manner, and that's very important. Now, what are the authorized vaccines in India? We have Covishield, Covaxin, and Sputnik. We talked about what are the different mechanisms of action, so I'll not go into that again. The approval was given for Covishield and Covaxin was somewhere in the starting of this year, and then the vaccine was deployed, and then Sputnik was somewhat recently. Covishield vaccine, just to remind it again, it's a viral vector vaccine manufactured by Serum Institute of India. It's somewhere around 70% efficacy overall. But what we have seen is, and this is what I was talking about in the previous slides, that if you increase the gap between two doses, the efficacy increases. And that's something which is very much documented, and hopefully this would also give us a better protection here also. Covaxin, it is a whole inactivated virus vaccine manufactured by Bharat Biotech. Somewhere around in March this year, the data was presented to ministry, where the efficacy was somewhere around 81%. Now the most interesting part, according to me at least, because I think most of the questions are somewhere around which vaccine is better, Covaxin is not good, or Covishield, the efficacy different. Like Pfizer vaccine is having 95% efficacy, so the people those who are in US are better protected, etc. So let's talk about certain basics around the vaccine efficacy and the different angles to look at it. So this was a study which was published in Lancet in April 2021. So I'll not go into the details of everything, but for us to understand and discuss, what we need to look at is on the x-axis in the down below, what you're seeing is the different names of the vaccine manufacturers. So you have Pfizer, you have Moderna, you have Gamaleya, is a Russian one, and Johnson & Johnson, AstraZeneca, Oxford. So this is our Covishield. The strain is same. Is just being manufactured by Serum Institute of India. On the top, these pink things, what you're seeing are, let's say these are efficacy. We call that as relative reduction of risk. But for our understanding, let's say Pfizer has got 95% efficacy, Moderna around 94, Gamaleya 91, and Johnson & Johnson AstraZeneca somewhere around 70%. So does it mean that the vaccine or the Covishield, if it is having 70% efficacy, is inferior to Pfizer? Uh, do we actually relate it like this? That's where I wanted to spend some time on this slide, because this is actually not the interpretation. So if you remember when I was talking about the different phases of vaccine development, what happens is we look at what is the outcome that I'm looking at, and that's one. So we'll talk about the outcome of the vaccines in the subsequent slides. But again, to reiterate, in these kind of vaccines for viral diseases, our ultimate aim is, or the end point is, that we have to save lives. And what do we mean by that? The efficacy in terms of how much a vaccine can reduce the severity or the development of severity. So the vaccine's endpoint or the outcome is making sure that if you're vaccinated, you're protected against development of severe disease or the severe patterns of the disease, so that you don't ultimately go into the extreme side of the disease, which is getting getting hospitalized or developing very serious infections, or ultimately in worst case scenarios, death. So that's the main outcome or the endpoint for these vaccine developments. So the efficacy for this is almost more than 95%, for example. So that's the maximum efficacy we have, and it's equal for all the vaccines. But when we look at these efficacy, if you remember phase 2 and 3 trials, when we talked about that we divide the patients or the people into some people get the vaccines and some people do not get the vaccines. And then we calculate then how many develop the disease and how many did not develop the disease. And then we try to calculate the efficacy from there. And that efficacy is actually against that how many people are actually developing the disease in terms of anything. It can be asymptomatic infection, it can be mild, it can be moderate, or the severe disease. So that's why you get a difference in certain efficacy of the vaccines. Also, at the same time, there are several other factors which we'll look in the subsequent slides. But then the understanding of this is whether the vaccine which is having 70% efficacy is inferior to the vaccine which is having 95% efficacy is not right. That interpretation is not right. The interpretation is actually, in a way, for example, I have got 100 people in my family, and if all of them get the vaccine, Covishield vaccine, does it mean that 7 people are protected and 3 are not? If I talk about the 70% efficacy, no, that's not the relation. The understanding for efficacy is that what is the relative reduction of risk for me? For example, if I have got 70% or 80% reduction of risk of developing disease. And that is how we interpret. We do not interpret by that 100 people got it, then 95% efficacy, 95% people will not get the infection, but 5 people will get the infection. That's not how we interpret. And that's why it is not actually a good idea to compare between the efficacies and looking at that. And also remember, always remember, the efficacy for transmission or for only developing the disease is not the endpoint. The endpoint for us is, or the most important thing for us is that the people should not develop the severity or the severe kind of diseases. That's where you have to go to the hospital and get all the different kind of worst experiences and the outcomes. And that's very, very important for us to remember. Now, let's see what are the different factors why we have different efficacies also. That's very important for us. So if you look at the epi curve, so this is the curve for our country. You see, this is the first wave, second wave, and now hopefully we are here. So the cases are coming down. So because the vaccine developed, usually the vaccines take around many years, and then in that particular period, because you're taking years to develop a vaccines, you try to, in those big trials, usually you have all the different seasons, you'll have different peaks and troughs, etc. covered. But in the fast track manner, sometimes this is the disadvantage. So what happens is, suppose if you look at my cursor, suppose you finish this quick trial here, or you finish the quick trial somewhere here, or maybe a big trial somewhere here. So what happens is, in these trials, suppose when you're having the peaks incorporated in the trials, you would have more number of cases. You would have, you all know that there are variants roaming around, so that has immune escape mechanism. So probably the efficacy would be a little reduced. So that's why, again, I'm repeating the same thing. That it is not a good idea to head on to compare the efficacy between two vaccines, because there are several hidden factors in terms of how was the population profile, how was the ethnicity covered, which country, etc. So there are several reasons for us to not to compare the efficacy between two vaccines directly. And this is the most important thing for us when we talk about what is the most important thing when we get the vaccines. So vaccines are giving protection in this right extreme. So a person, when you develop COVID, you can either be asymptomatic, you can have mild, moderate, or severe illness, and then critical illness, and then the end point. But then if you are vaccinated, and this is where all the discussion that I was having, you're protected against this. You can have asymptomatic infection sometimes. You can have a bit of infection, and that's not where we have to worry much. Yes, it is important because it has to curb the transmission and reduce the pandemic, etc. But then, what is the most important thing for us for this vaccine is this, and it doesn't mean that it is only giving protection against the severity of the illness, because overall, what I'm trying to tell you is it is going to give you protection against each form of infection or the stages of infection. But the maximum protection is for severity or the critical illness. And this is what I was talking about. So these are the different studies wherein we have seen that this is the protection against the transmission or getting the symptomatic infection. So it has got the protection against the transmission. So it definitely helps to reduce transmission. But the maximum impact or the maximum effect that the vaccines have is for the right side of the spectrum of the disease, which is, or the extreme side of the pattern of the disease, which is severe and critical illness. And this is where the maximum protection comes. Now, what we talked about is till now, the different vaccines and efficacy, etc. And then there are certain questions which we have received. So now we are going to go around the question-based kind of responses. So whether the vaccines can provide long-term immunity or not. So it's not the right time to actually talk about it because the trials are still ongoing, the studies are still ongoing, and probably what we are showing here or discussing here would change in coming months. But as of now, the information that we have, somewhere around 6 months is vaccine-induced immune response or the immunity that is providing. But again, I'm saying we are getting promising results from studies which are telling us that probably we are getting much more than this. But we'll have to wait for the results of those studies. And the natural infection-induced immune responses. Suppose you develop the COVID infection, then you remember the few initial slides that once you have the infection, then also you would have the immune response. And that immune response, the duration is somewhere around 6 to 8 months. So this is in terms of the immune response that the body has. Now, the most important question or the question that we have received is whether vaccines can break the transmission or not. So I think the answer I gave in the previous slides as well. If you looked at what happens is it is definitely going to reduce the transmission. So when it is going to reduce the transmission, then definitely it means that the pandemic is ultimately going to be stopped or curbed or maybe controlled. That's the best word. Uh, but what is important? The most important thing is that the vaccination should happen in a fast manner and everybody should get vaccinated unless until we all are safe. I unless until everybody is safe, we all are not going to be safe. That's very important in a message that should go. And then that's the reason we are having all these kind of sessions so that we can give a positive message because there's a lot of vaccine hesitancy among the different groups, not just even in the medical staff. I would say, I mean, we are having a lot of vaccine hesitancy, and I think it's very important to pass on the message, which is based on science. So it is not a belief; it is evidence-based medicine telling us that yes, vaccines work, and then that's the only tool we have at the moment, which can actually reduce the transmission or ultimately uh, save lives and stop the pandemic. Also, at the same time, because it is important for us to uh, the faster and faster vaccination would also help us to make sure that the new variants are not developing, and that's very important. So. The variants develop when the virus is free and roaming around in the community. So that's where the virus gets muted. So it's very important that each one of us get vaccinated as soon as possible. And also, remember, there's one vaccine which is already there, even if you're not vaccinated, it's a social vaccine, which is your all the COVID appropriate behavior that you do, mask and hand sanitization, etc. So you have to keep on following that. So we do vaccination and then we all following the COVID appropriate behavior. Then we develop a certain immunity in the community, which is the concept is called herd immunity or the herd protection. What that means is for different diseases, there are different thresholds. For COVID, the threshold is somewhere around 70%. So what that means is, if your 70% of the population is immunized, then the rest of the population, which is not even immunized, will get the protection. So this is how beautiful the concept is. But then we all need to reach to that mark as soon as possible, get us immunized and protect ourselves finally. So, just in a lighter note, I was listening to somebody who was saying that if we all are vaccinated, if we are immunized, then probably the third wave or the subsequent waves, if at all they're coming, is going to be just like a common cold thing. Because and that's true. If you all are vaccinated, you're not going to get very sick. You're not going to get critical illness. Then ultimately, it's just going to be a very mild or asymptomatic infection. So that's how we win the race. We talked about this slide already, that what are the benefits of vaccinations on transmission and then on severity of disease. Uh, and then one slide on breakthrough infection. Breakthrough infection is the infection or the COVID infection that you get after you're vaccinated. So there was a lot of queries and a lot of questions about whether if you had the COVID vaccines, then you can develop the disease or not. So it's almost nil. The chances are nil because we'll see in the subsequent slides because COVID and also we saw the basics of immunology. We discussed about it. So it's inactivated. The virus is such or the antigen is such that it doesn't give you the disease. It is only giving you the immune response or the ability to develop the immune response. And if you look at this is from our PIB, our government site. The data is little outdated, but still, it's still 20th of April. And you see the doses received by Covishield or Covaxin, the positivity is somewhere around 0.04%. For Covishield, it's 0.02, 0.03. It's almost same. Huh? It's almost nil. The chances of you developing, and look at the doses in almost like 15 crores. So we can definitely say that there are almost nil chances to develop breakthrough infection. So till now we talked about the theoretical aspect and some of the interesting things of how vaccines work, etc. Now we'll go into certain questions, answers, and the different aspects, and then in the end we'll open for Q&A session. And now I would request and I ask Dr. Aqsa to please take it over from here. Thank you.
Thanks, Dr. Amit, and thank you, ITech, for having me. Dr. Amit has already created a foundation in terms of vaccine, the rationale behind immunity and everything. And I can see people asking questions. Yeah, keep putting them in the chat box. We'll take them one by one and how that develops. And let me also want to tell everyone that, I'm someone who is from the community. I'm someone who is a transgender person. And I always say that I was probably the first transgender person in India to get vaccine, since I got it on first day of 16th Jan. And also heading a vaccination center here, in addition an investigator in the Sputnik vaccine trial also. So having faced the difficulty as a transgender person in the COVID and the vaccination, or understanding those challenges which are there, and also being from the vaccination center and knowing what are our limitations and how much we are trying to do, I'll try to answer your questions in from the scientific as well as from the logistic reasons, sometimes that we have. So the first question often is that, can people who are living with HIV can or they should take vaccine or not, right? So first and foremost, now we should always remember that there's no evidence to the contrary. We have never found that people living with HIV who have taken the COVID-19 vaccine have got any adverse events. Now, if you look at the logic, none of these vaccines are live virus vaccines. As Dr. Amit mentioned, these are all either inactivated virus vaccines or vector vaccines or subunit vaccines, and therefore this virus cannot replicate in the body. It's not like oral polio vaccine, which had a live attenuated virus. And therefore, there is absolutely no risk that one can get COVID infection by getting the COVID-19 vaccine, even if their immunity levels are low, as in the cases of PL-HIV who do not have viral suppression. So no, there is no danger with the vaccine. So be confident and take the vaccine for COVID-19. In fact, we know that people living with HIV are actually more in need of the COVID-19 vaccine, because especially those who do not have viral suppression, their immunity may be down. And that's why when they get infection, they may have a more severe infection, right? They may also have simultaneously a lot of other opportunistic infections which can further add to the disease burden. Hence, it's very important that all PL-HIV are motivated and also given confidence to take the vaccine. Next slide, please. So this is the statement by UNAIDS, which says basically the same thing that we have been reiterating, that it is very safe and it is also effective in the cases of person living with HIV. Sometimes, people who are immunocompromised may not be able to develop probably the same amount of immune response as compared to someone who is not immunocompromised, but then it is not zero. Okay. And what is important is that it is going to protect you against severe infection. It's going to protect you against death. And therefore, you must go ahead and take the vaccine. So it is safe also, and it is effective also. Two things to remember. Next one, please. This is the Government of India statement. As you can see that there is a letter which has been written to all the SACS PDs, where it's clearly mentioned that irrespective of the CD4 count, irrespective of the viral load, whether it is suppressed or not, for taking the COVID-19 vaccination. They are one of the groups that should take vaccine as early as possible. Next. In fact, if you remember that when on 1st of March, when Government of India started what we call as the age prioritized groups. So पहले सिर्फ healthcare worker and frontline workers के लिए था. Then we came to the people who are 60 plus and people in the age group of 45 to 60 who had one of these 20 comorbidities. And if you look at number 9, it talked about immunodeficiency or HIV infection. So in fact, it is one of the prioritized group. Now, of course, vaccination is available to everyone who is 18 plus, irrespective of whether they are lactating or not also, right? So even the women with HIV who may be breastfeeding are also encouraged to go ahead and take the vaccine. Next one. We have already discussed about this, that since PLHIV are immunocompromised, does vaccination facilitate infection in them? Well, absolutely not, because this is a killed or inactivated virus vaccine and it does not have a live virus in it. Often, since in India now we've got 3 choices available. You've got Covishield, Covaxin, and Sputnik. And whenever someone asks me which vaccine they should take, I'm like, always take the vaccine that you can get the fastest, because you are wasting your time by thinking too much about whether to take the vaccine or not, and if to take, whether to take the Russian, the Indian, or the British. Just forget about all that. Take whatever vaccine is available to you fastest. That's the best way to protect yourself and to protect the people who come in contact with you. As far as the vaccine efficacy among the PLHIV is concerned, we have seen that yes, they also develop a good amount of immune response, and even there is immune response in those who are immunocompromised. And in fact, COVID-19 is not the only vaccine that we recommend in PLHIV. There are many other inactivated vaccines which are being given, and this is also one of those vaccines and very much needed. Next one. Now there was this question ki, is a protected group like PLHIV was also included in the vaccine trial safety and efficacy in the phase 3 trials or not? On a lot of vaccine trials, Dr. Amit mentioned that there are more than 250 vaccines which are under study. And many vaccine trials, the protected groups, like for example, pregnant women, lactating mothers, children, and even PLHIV were not included. But in a few of the studies, they were included. And what we have seen is that when these people were included, and these were the people who did not have immunocompromised state, they were on ART, they had fully suppressed viral load, and their CD4 count was also good. In such cases, we have studied and we have found that the antibody response was as good as anyone. There was no problem in developing antibody response. So especially, people who are not having viral suppression, उनको तो बोलो आज ही जाके वैक्सीन लगा लें, है ना? No wasting of time, please. Next one. So this is another, in vaccine with living with people with HIV, without HIV comparison, and again similar results as we have mentioned. Next. Next slide, please. Are there any interactions between ART medication and COVID-19 vaccine? Well, we have been giving vaccines now in India for nearly more than 6 months. We started it in January 16. We'll be completing 6 months today. And we have also given it for nearly 9 months, for in the world. And people in the world have been taking all kinds of vaccine, including ART, including PrEP, including hormone replacement therapy. And none of these medicines and the vaccines have got an adverse interaction. So even if you are taking ART medication, even if you are taking medication for STI or PrEP, or taking any other vaccination, for example, the rabies vaccination schedule is going on, even then you can go ahead and take the vaccine. there's a huge amount of rumor, mongering which is happening. बहुत सारे लोगों ने सुना होगा कि कोविड वैक्सीन लगाने से बांझपन हो जाता है, that it causes infertility. This is an absolutely just conceived out of someone's devilish mind. It has got no basis at all. None of the vaccines rather have any effect on fertility. Yeah, so please do not give in to such rumors. In fact, dispel such rumors. Anytime you get such message, please educate them back, that it does not cause infertility and they should not be spreading such messages. Next. In fact, after taking COVID vaccine, most commonly what people get is fever. There can be myalgia, there can be headache, which is generally for 1 to 3 days, easily relieved by taking paracetamol tablets. Some people, we have seen that their blood pressure levels have increased or their heartbeats have increased, which may be also due to anxiety post-vaccination. But then otherwise, there are no major side effects that have been seen. We just recently, the government of India concluded its AEFI study, adverse events following immunization, to see about the reactions of the vaccine, serious adverse reactions, and whether there were any deaths. And so far, out of nearly 25 crore Indians who have been vaccinated, there has been just one death which has been linked to the vaccine, which is all as good as zero. So do not be worried about it. There have been, however, reports that 1 in a million or so there is incidence of blood thrombus formation, what's called TTS or thrombosis with thrombocytopenia syndrome. And again, it's very rare. In India, we have not really found that too much in as far as the anecdotal evidence is concerned. And that should not prevent anyone from getting the vaccine. So even if you are a woman in the reproductive age group, please go ahead and take with confidence the Covishield vaccine. Next. As far as any special advice is required, well, absolutely no special thing needs to be done. So before going for the vaccination, you should have confidence. And after coming back from the vaccination, you should have confidence that what you're doing is right? The serious events are not really much seen. And whatever side effects you see are going to be same as a person without HIV, right? So there's not really anything special as a PLHIV that you need to do for the COVID vaccination. Next. Now, who should not take the vaccine? Now, I often say that instead of remembering who can take, I'm on heart medication, can I take? I am on epileptic medicines, can I take? I have sulfa allergy, can I take? Instead of remembering all that, just remember who cannot take the vaccine. तो कौन नहीं ले सकता? सबसे पहले तो currently pregnant women are not recommended to take the vaccine. The decision on that is still pending in India. Maybe in the next few months the government will allow for pregnant women, but right now it's not there. Second is anyone who has got an allergic or anaphylactic reaction to any of the components of the vaccine. From where will you come to know the components of the vaccine? This is in public domain. It's also there in the leaflet or insert in the vaccine. So you can see if you have allergy to any of the particular amino acids, for example, that may be present. Secondly, anyone who has developed an anaphylactic reaction after taking the first dose of that vaccine, then you cannot, and it was severe one, right? It was anaphylactic reaction, then you cannot give them the second dose. They'll have to take some other type of the vaccine. So if you had, for example, a reaction to the Covishield, you may have to take Covaxin instead of that. And anyone who had thrombosis with thrombocytopenia syndrome or blood clot developed after first dose of the vaccine, then again, naturally, the second dose need not be taken. If you have drug allergies, you can take the vaccines. If you have food allergies, you can take the vaccine. If you are lactating, you can take the vaccine. We have already talked about the breastfeeding and the pregnant women. People with comorbidities, people with heart disease, respiratory disease, liver diseases, all of these are actually supposed to be taking the vaccine more, the more in the sense that they should be prioritized for taking the vaccine. We have seen that in pregnancy, it's a little controversial right now, because Foxy, for example, has recommended that it should be taken by the pregnant women, but Government of India has not currently allowed. In fact, pregnant females who are in very high risk professions, for example, the healthcare workers or they are currently in a wave, then in that case they can also take the vaccine. That's their right by discussing it with the medical professional, but otherwise currently it's not recommended. A very commonly asked question is कि मुझे कोविड हुआ था अभी 15 दिन पहले, तो should I take the vaccine or not? So if you have had COVID, then you must wait for 3 months of time before taking your first dose, or even if it is your second dose, then also you should wait 3 months of time, even if the recommended gap is less than 3 months. So जैसे for example आपने कोवैक्सीन लिया था and you know that the second dose of covaxin has to be taken after 4 to 6 weeks, but in between you got COVID, and you should wait for 3 months and then take the second dose of covaxin. Okay. Similarly, if you are having some acute infection or acute febrile illness or something of that sort, you have got fever, please take medicines for that. Once you are well, then you can take the vaccine. Okay. You are having any other disease, you are not feeling well, better to not take the vaccine at that time, because what happens is then whatever symptoms you develop, you keep attributing them to the vaccine and you call them side effects of vaccine, whereas it's your old disease only which is continuing. We have already discussed this, that people who are vaccinated are unlikely to transmit, they are less likely to transmit the infection because उनको ही infection होने के chance कम है, and naturally then the transmission of the vaccine is also going to be less. But then remember this, that even after you have been infected and you have developed natural immunity to it, it may or may not be lifelong. We don't know. We'll have to study that for a longer period of time. So we may have it for 6 months, we may have it for 1 year. That's what some studies have found out now. But you may still get infected by another variant. है ना, हमने देखा है कि जिन लोगों को पहले कोविड हुआ है उनको दोबारा भी हुआ है, and then they can also spread it to others. So even if you had COVID infection, you must take the vaccine. Next one. Yes, now this is very interesting. Now often people ask him, वो कोवैक्सीन लिया था फर्स्ट डोज, अब सेकंड डोज नहीं मिल रहा है, then can I take Covishield instead of that? No, you cannot. The studies are going on it, to find out if you interchange, if you take one dose Covaxin, one dose Covishield, will it give immunity, will it give more, less, or whatever. But till the results have come, there is no recommendation of mixing. Do not mix the vaccines. If you've taken first dose covaxin, take the second dose of covaxin only. Even if there is a delay beyond what is stipulated, you will only take the second dose. So agar suppose aapne covaxin liya and now you are getting the second dose after 2 months, after 8 weeks, though the recommendation is 4 to 6 weeks, then also you will take only the second dose. You will never restart the vaccination schedule, and of course no mixing is allowed. The question is, I am a 45-year-old field worker. What documents do I need to register for the vaccination? There are two ways how you can register for the vaccine. One is that self-registration can be done through the COVID portal or through the Arogya Setu app. Okay, and you can just give one of those IDs which are there. One more ID which has been added to this list is the disability identification card. In addition to that, there's also an option that you can just walk in to a vaccination center without pre-self-registration through the app. You can just walk in with one of these IDs and the staff over there will help you register on the spot. Okay, so both the things are available. You can pre-register also, and you can also go for walk-in or what is known as the on-the-spot registration. Can a person report positive on RT-PCR after getting COVID infection? Well, not due to the vaccine. If someone had taken COVID vaccine and then their RT-PCR comes out positive, it's because they got infected. It's not because they got infected due to the vaccine, but they got infected because they came in contact with another infected person. So as we have been mentioning again and again, this is not a live virus vaccine. It cannot make you turn into RT-PCR positive. A lot of people used to ask, मुझे travel करना है और उसमें RT-PCR का टेस्ट होगा, तो अगर अभी वैक्सीन लगा लिया तो पॉजिटिव आएगा? नहीं. RT-PCR is antigen test. It is not an antibody test. Your antibodies may come positive, but RT-PCR is not going to come positive. what's to be done in the case of the delay in the vaccination special situation. So we have again discussed this, that if there was a laboratory confirmed case of COVID-19 infection, you have to defer it by 3 months. If you have been given some antibodies या कौन सा प्लाज्मा दिया हुआ है, तब भी आपके अंदर जो एंटीबॉडीज हैं, दे मे इंटरफियर विद द वायरस जो हम इसमें से दे रहे हैं, for that to develop immunity, and again therefore 3 months of delay is needed. Okay, next one. What's the recommended gap? I'm sure most of you know this. So the recommended gap between the 2 doses of Covishield is 12 to 16 weeks. Abhi increase kiya hua hai, it is 12 to 16 weeks. And after 2 to 4 weeks of the second dose, you will start having sufficient immunity. उसके पहले खुश नहीं होना है कि मेरे को वैक्सीन लग गया, खुश होना है, but don't think that now you are immune. Even after 2 doses, there is no guarantee that you will not get infection. So keep taking appropriate behavior. For Covaxin, it is 4 weeks to 6 weeks ka duration, and again you get immunity after 2 to 4 weeks. And for Sputnik, it is 4 weeks of time. Next. What action can a PLHIV who has been fully vaccinated for COVID-19 take? So first and foremost is feel happy that you got the vaccine, you got an opportunity to take the shots. After 2 weeks, you should have sufficient amount of antibodies that would be developing. And even before that and even after that, don't forget COVID appropriate behavior. Use mask to cover your nose and mouth, hand hygiene, and physical distancing, right? That's very, very important to keep on protecting yourself from infection. And also, it's not just against COVID-19. You know, this simple basic hand hygiene, masking, and social distancing can also protect you from a lot of other diseases. So better to practice them. Yes, absolutely. You need to keep on using masks. You need to keep on doing physical distancing, and you need to keep following the COVID appropriate behavior. And don't forget, you also need to keep on motivating other people to take the vaccine. You know, just because meri lag gayi, now I don't care about other people. No. As Dr. Amit mentioned, none of us is safe until and unless everyone is safe, right? So if you want the COVID to go away and for our old life to return, then you must ensure that everyone gets the vaccine. Next. What would be some of the strategies to fast track vaccination in PLHIV and key populations also? So the government is doing a lot of things, on its own. It's trying to also involve the ground root organizations, NGOs, ART centers, and others to ensure that the PLHIVs are going and taking the vaccine. It's very, very important that we all people who are associated with National AIDS Control Program come together and ensure that everyone's misconceptions, myths are dismantled, that they have a clear idea, they get confidence in the vaccine, they have trust in the vaccine, and then they go ahead and get their 2 shots with confidence. So coming to some key points that we must remember, very importantly, COVID-19 vaccines are safe as well as effective in cases of PLHIV. All PLHIV, irrespective of their CD4 count, irrespective of their viral load, are eligible and should take the vaccine. As far as the side effects are concerned, PLHIV do not have any additional side effect as compared to any other person. There is no harm in taking ART and vaccine together, as there is no interaction. So continue taking your ART medicines. Please adhere to them. Even after getting vaccinated, COVID appropriate behavior has to be adhered to. Masking, physical distancing, hand hygiene, very important. Vaccination is the most effective tool out of everything, right? So if you have the chance, please go ahead and get the vaccine. Spread trust about vaccines, dispel vaccine myths and misconceptions, spread positivity and these messages. And very importantly, even if you hear that किसी को vaccine लगाने के बाद infection हो गया, fine. At least being protected against severe infection. ICU में तो नहीं जा रहे हैं, right? So this is the message that we should all take from today's discussion. Over to you, Dr. Amit.
Thank you. Thanks a lot, Aqsa, for your time and presentation. So I think now we have come to the end of the session, and then now we have received a lot of questions. So what I have done is like I've kept some of the questions in the slide, and there were many questions which were regarding the COVID-19 infection per se. So this intention of this topic or today's session was COVID-19 vaccination. But then in case if a separate session is required for COVID-19 infection, and then how does it affect a particular community or different scenarios, then we can take it up separately. But for now, we are focusing on the questions related to the COVID uh, vaccine. So some of the questions that were already there, I think we'll just quickly read it, give the answers, and in the end, then Shweta would help us to see what is there in the chat box, and then we'll try to answer that. So, Dr. Aqsa, what I'm going to do is like quickly, I'm going to read and give answers, and then if you want to add in, please keep doing it so that we can save time because we have hardly 15 minutes left. Is that okay?
Yeah.
So the first was, will vaccination affect my body if I'm taking hormones? So I think we have given the answer already. Dr. Aqsa talked about it. So the answer is no, there's no problem, and you can simply go and take the vaccine. What are the precautions I should take after vaccination or before vaccinations? I think that is covered. COVID appropriate behavior is the answer before or after vaccination. Is there anything I should be careful if I'm living with HIV or on ART when I go for vaccination? We talked about this, so I think hopefully the answer is there. Will I get corona if I take vaccination? So we explained about this, right? So how does the vaccine work? I mean, what protection they give? So there are still chances that you might get infection, but you'll not develop the severe infection. That's important. That's why you keep having the COVID appropriate behavior. Which vaccination is good? The answer is already being given. How do I deal with the vaccination after effect at home? So we talked about it, that local and systemic side effects are pretty common, but then those are very, very minor things. So you can have fever, headache, etc. If required, you can take paracetamol. If it is troublesome, and if you think that there is something which is continuing after 2 days, or you're still having a lot of difficulty, you can reach out to your nearby medical center or the doctor. How do I register myself for vaccination? What if I don't have Aadhaar card, and how will I access to vaccination? I think Dr. Aqsa gave answer to that already. Is there anything I have to be careful after vaccination regarding substance abuse, alcohol, drugs, etc.? So see, there is no relation between, as such, between vaccination and the other things. But then, in general, whatever effect it has to the body, it would have to that effect. But there's no particular relation or a direct relation between vaccination and anything else. If I have gone through the gender change surgery, for after how long I can go for the COVID vaccination. So if you remember, what we talked about is, suppose somebody is having a very severe illness, or for any other reason, if you were hospitalized, or you had certain thing which is making you that you should take care and you should stay in the hospital, or you were in ICU, then the gap, it is in general recommended around 4 to 8 weeks. So I think in those special scenarios where you had gone through certain procedures which were making you hospitalized, in that scenario, or you had the severe illness, that is where you can have a gap. Otherwise, other than that, there is no other gap required. If I have recently recovered from corona infection, how much time I should take? So we talked about this. 3 months is what is recommended now. If I have TB infection, can I take the vaccination? Yes, there's no problem. So remember, what we talked about is TB can be of any form. If you have a tuberculosis meningitis, for example, there is a disease which is making you, or you had the severe illness because of which you were hospitalized. These are two different scenarios. So if you were hospitalized or you had the serious illness, in that case, you probably would have to have the gap. Otherwise, not recommended. Do you want to add in something here, Dr. Aqsa, for any of the point, or shall I move to the next slide?
Yeah, we can go to the next.
Are there chances post-operative transmitted women who are on HRT of getting embolism or thrombotic events after getting vaccinated? So I think we gave the answer to that. there's no risk we have. See, we have seen a very rare event, which we talked about in the presentation, but for some reason, it is very rare again in India. So we had certain cases in UK because of which, if you were following the news, the vaccines were stopped in between, then it started, then again stopped, and then it had a particular, the mechanism is still not clear. Some are talking about that it's of autoimmune nature. So what I'm saying is it's very rare in India, uh, and hardly we have seen any case. Whatever is being reported was there from other countries. So in that way, theory and practical aspects both are saying that we are safe and there's no problem. You can go ahead. And for all other questions that you're having with vitamin D deficiency, hypertension, diabetes or CVD, renal issues. So all those who are having comorbidities, these are the people those who should take the vaccine. So it is not about whether it is safe or not, because that's where you're going to get the maximum protection, and you should advise and request and to your colleagues or your family members, if somebody's having it, please go and take it, because that's where it is most important. So who have just recovered from surgery? Yes, we talked about this number of trans women who have been through castration procedures but never took HRT. How safe? It's perfectly all right. There is no relation to anything.
I would
And
just
in
add
the
over here that people
yeah,
who are going for surgery, their HRT stopped 4 weeks prior to surgery, and it's restarted only around 4 weeks later. So when they are on surgery, anyways, their risk of developing thrombosis, anyways, HRT is removed, so it decreases. So before surgery, you can definitely go ahead and take the vaccine. And as Dr. Amit mentioned, post surgery, once you've recovered, you come back from the hospital, you are feeling well, you can take the vaccines.
thank you. Uh, there were two questions which I thought to include or not, but then this is where, there were questions around how many other countries are having the vaccination drive for trans individuals. So it's very much the same thing. I mean, as in India, the other countries are also having the vaccination drive. There are some issues which are common in certain countries, so that's there in India, also in other countries. But otherwise, yes, I mean the vaccination drive is all there. Is there any authentic data available till date in public domain about how many transgender people have been vaccinated? So for that, I do not have the information as of now handy to me to see the segregated data. In case if we get it, and then we can
I'll just add on to this. So in the COVID portal, you have got three markers for gender: male, female, and others. And we do have the information available for the others category में कितने लोगों का vaccination हुआ है. But then not all transgender persons will be choosing the others marker, and not everyone who is in male and female are cisgender. Some of them may be also transgender. So it would be wrong to consider that all of those others are transgender. For example, I am a transgender woman, but my IDs are on female gender, and I also got registered in COVID as a female. So I am not going to be found in the others data. But roughly, if we look at the others data, then that's approximately 5% of the total estimated transgender population in the last census of roughly 4.9 lakhs or so, which is much lesser than the general population, which is currently vaccinated to the tune of around 20%.
Yeah, no, thank you for raising that point. I mean, I think it's really important, because all of us should get vaccinated, and also this the column male, female, and other is also, as you said, inclusivity, and we don't know for male and female whether they rightly kind of captured that data or not. So that's the reason I was saying that we don't have very clear information on that. But yes, that's important, and that need to be taken forward. So I think that's where we end with the questions that we had received. And Shweta, over to you if you want to share questions from the chat box here so that we can take.
Yeah, so there's questions related to booster doses. Do we need a booster dose after 2 vaccination doses?
Mm-hmm.
Then there's one about drug allergy.
Shall I answer one by one?
Yes, ma'am. Yes, sir. Please.
That's better. So for booster, see, we talked about it, right? The trials are going on, the studies are still going on. So whether we are going to need booster or not, that is something which we'll see in future. There are studies saying that yes, we might need it, but then for us to answer that right now is not appropriate, because we'll see what is coming from the proper channel, and whatever the information received from GOI, we'll take it. And also, just to comment on one of the topic that we were discussing for pregnant women. So as Dr. Aqsa was mentioning, that Foxy is saying yes, but also at the same time, because yes, it is recommended by certain bodies, and also from WHO, there's a yes, but then we are waiting for our national recommendation, and from the GOI, the moment we get the information from GOI that it can be included, we take it forward from there.
The next question is, I have drug allergy. Can I take the vaccine?
Yes.
This has been covered, but in case you would like to reiterate again.
About drug allergies?
Yeah.
Yeah, this is covered. This is well covered.
Yes.
Yeah.
Okay. Suppose a person is due for the 3rd dose of hepatitis vaccine. Can he take COVID vaccine, or should he postpone for a later date?
Okay. So, see, what if you, from the government of India, the very initial recommendation that came was that when you're having COVID vaccination, it is you can have a gap of around 4 to let's say around 1 to 2 months of gap between the different doses. That was the first recommendation that came. Then what happened was there were different vaccines and the different needs came up. So, for example, rabies, then TT, then hepatitis, and so on. So in general, there is no contraindication, or nobody is saying that you should not combine these, because the mechanism of actions are a little different, and it is seen that it is not going to have any adverse effect. So that is what, and then from rabies side, it had come and they released the document that yes, you can take it. For TT also is not a problem. So hepatitis also is following the same. I was just covering for in case if there are questions on rabies and TT and etc. So there was one document which came out, but then later, I think hopefully if there is a document coming out from even from the Ministry Division of Immunization saying that all these are, but it's very difficult for them to release the document one by one for each vaccine. Yeah, but the answer is yes, it can be taken.
Thank you, sir. We'll just take up the last question from the chat box. What about the vaccination for children below 18 years of age?
So as of now, it is 18 and above. There are trials going on. I am sure all of you must have seen the news and the different sources. The trials are going on for less than 18 years, 2 to 18 years. And in US, the Pfizer is going for 12 above, etc. So the trials are going on till we get the promising results and the decision by the recommendation committee. And then we get the results, and then we say that yes, it is being recommended, and until then we have to wait for 18 and above. Till now, it is only 18 and above.
Yeah, we have one more question, sir. Ms. Amrita Soni, can you please unmute yourself?
Hello, thank you so much.
Yeah.
Actually, I just have a questions for both of them. Like recently, there was a patient in Patna, Bihar. He was an HIV positive, and he took a vaccine, and after that he got a COVID positive. And after a few days of COVID infection he was having, after 6 days he started a bleeding from cuff, and he got diagnosed for the TB also, except MDR TB. So in that case, like the people who are on HIV as well as on TB, and there are many a trans community who are on HIV, TB, and taking other side the hormone treatments also. So does this vaccine, because the 3 doses are the higher sides, and again this vaccination, will their body will be able to manage this all things?
Okay, thank you. Thanks a lot for the question and the concern. See, my answer is so for I think Dr. Aqsa was trying to explain in her talk also, and then you can take it after me, Dr. Aqsa, if you want. So, see, when you're going for vaccination, for example, you go for the vaccination, you take the vaccine, but then there are chances that probably you would have had the infection before, a few days before, or maybe on the same day when you were there in the vaccination center. So once you get the vaccine and then you can develop COVID infection, that's very much possible, because if you do not follow the COVID appropriate behavior, there are chances that you might get it. And if you remember, if you are if you're vaccinated, then only after somewhere around 2 weeks you will have certain immunity to for the protection. That's one thing. So COVID, you get the infection and on the same day or maybe a few days before, and then you are not still having enough of immune response that we say around 2 weeks, then there are chances you might have received the infection from somewhere else, that particular patient. Then the patient had tuberculosis, also had certain other disease that's not related to COVID vaccine. It's per se because the patient had those diseases. So there's no relation to COVID vaccine in that case. If let me know if it answers your question, or you know.
No, doctor, I was asking if the patient is having HIV, he's on HIV treatment, ARV drugs. He is on TB drugs also. He's taking TB drugs. Again, he's on also, if it's a trans community, she or he must be on a hormone treatments. If these three treatments are going on a regular basis, and after that, if the person goes for a vaccine, is there any side effects for that person? Will he face that in future or what?
That's what we explained. I mean, I think what what we should talk about is why it is important for the person to get vaccinated, because the person is having all the risks for developing the serious illness. So I think it is our duty and also our message that the person should get the vaccine as soon as possible. That's one. Second thing, there is no relation for COVID vaccine per se to develop or have, if you think that adverse events because of the vaccine, because the person is having so many other things. But what is important is the person should get the vaccine, because that is why it has got the maximum protective role for the diseases or for the illness that the person is having. Okay.
Can we take the next question, please?
Yeah.
Yes. After vaccination, a few community individuals got pimple-like boils on chest and neck. It increases day by day. How to treat it?
Okay. See, so after vaccination at the injection site, a person can develop a bit of swelling, and if that converts into something that is boil or something happens, or other than the site, if somewhere else, if somebody is developing some other things, it might not be related to the vaccine reaction. But then if it is troubling you, and if there are some infective sites, then probably please go to your nearest medical center, because the session here, I'm sorry, I'm not going to talk about how you treat those cases, because that is not something which we should advise. I think you should go to the nearest medical center, let the person see what is the relation to the vaccine, if at all, if there is something, and take the decision and treat the disease or whatever the person is having.
We shall be sharing the PPT as well as the recording with all of you. I think we can end this session now. Just one request, if participants can switch on their video camera, we would like to have a pic of happy faces. If possible, please switch on your videos. Just for 2 seconds.
Shweta, Dr.
Yeah.
Chinmay is all around, or she's?
No. So she,
Oh,
ma'am
no
had to leave. She had a meeting.
No problem.
Yeah. Thank you so much, everyone.
Thank you all
thank
for
you
the time.
to Amit sir and Dr. Aqsa ma'am for this informative session. Thank you to all the participants for patient listening.
Yeah.
Please do write to us if you have any queries. You can anytime email us at dlcsinfo@itechindia.org.
Thank you, ma'am.
Yes.
Thank you.
Thank you.
Thank you.
Thank you, ma'am.
Yes, we can end the session now. Thank you.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.